Welcome to Learning Unit number 4. This is a learning unit that I'm really excited to begin, um, especially as we talk about serving the vulnerable. I feel like we can take a look through a different lens as we learn about our vulnerable population by introducing the concept of mercy. Mercyhurst University, as you may or may not know, is tied to the Sisters of Mercy. And the foundation of what we do, what we value, our beliefs, and how we treat others. It's really the essence of what makes us so special. I couldn't think of a better place to introduce everyone, or reintroduce them perhaps, to our mission and core values and what mercy really means, especially to nurse leaders, than in the study of vulnerable populations and serving the vulnerable. So in this unit, we're going to really delve into the mercy mission of the Sisters of Mercy and the foundation of Mercyhurst University based on, we're going to look at our core values of being. And those are being socially merciful, globally responsible, compassionately hospitable, intellectually creative, reflectively aware, and ambassadors of service. Catherine McCauley was the foundress of the Sisters of Mercy. So learning more about her calling and mission, really looking at the history, helps us to further reflect upon the current mission of the university and how we live these core values. And you're going to be able to read a little bit more about what does each core value really mean. So we're going to finish the unit by completing a Mercy interview assignment and our discussion board posting. And we're going to also strengthen our philosophical foundation of care into concrete actions of nurse leaders, both for vulnerable populations and the nurses that we lead. So by the end of this week, you're going to be able to explore the Mercy mission, look at the core values, and really examine that history of the Sisters of Mercy and their impact on Mercyhurst University students, graduates, and especially graduates of the Integrative Nurse Leader Program. So you're going to complete your vulnerable population assignment, which is the interview on mercy values, participate in discussion 4, and complete this week's Journal of Loss. So you're watching this video, and next will be to watch the video on Catherine McCauley to really give us the history of the Sisters of Mercy. And this is the Sous Sipe of Catherine McCauley. So it's a pretty well done movie. Short, I guess it's a 23-minute docudrama, not movie. So I think you're going to enjoy that. And this is a video that was done. It's the history of sisters and Catholic sisters and the impact on healthcare in the U.S. in 5 minutes. And this was a video that was done by the late Cokie Roberts. You may be familiar with her name from NPR. So again, another very well done but short video. And the next gives you a little bit more of an introduction into the hospitals that were started by the Sisters of Mercy, and beginning with the founding of the Pittsburgh Mercy Hospital in 1847. So enjoy that brief video. Next, you're going to go to a link. This is a Mercyhurst University link. It opens to our chapel, which can seat quite a few. And then you go on, and I want you to review the mission statement and our core values. That's basically the information that you're looking at. And when I say socially merciful, what does that really mean? And we have like a little bit of a definition, I guess you would say, of the core values. So we see mercy as restoring human dignity, expanding our social relationships relations, and empowering us to reach out in compassion to others. So I ask that you review that site. Then you're going to read a brief nurse survey that was done I guess you could say post pandemic, after the worst of the pandemic, and to gauge nurses' mental health. And I think this is an important topic, and that I'd like you to review as you answer unit number 4, discussion board. So the discussion board includes reflecting on the Sisters of Mercy and Catherine McCauley, the foundress, who started our university almost 100 years ago, especially with our core values of being socially merciful. I want you to share how nurse leaders can show mercy to those we lead, our nurses, as well as our vulnerable population that we serve. So I want you to look at it really in a A-B kind of reflection. How can, based on our history and our core values, how can we show mercy to those that we lead, that's A, as well as the patients, especially those patients included within our vulnerable population that we serve. And in order to do that, you have reviewed the videos, and also you're going to bring in the content of nurses' mental health and well-being into your response. Next is the Journal of Loss, and this is where I'm asking you that as you've been writing about your loss, to think about the positive changes that may have come about as a result of your loss. Sometimes the loss is so acute and so recent that there's no way we can think of positive changes. But perhaps you're able, to reflect on some things that might be positive that come about in the future. Oftentimes we can think about some of the positive changes that can come about in the future, even if we can't think of anything right now. So I'm asking you to reflect on that. If you can't, you're perfectly fine. This is again your journal on loss. I'm just clicking on and seeing if you've completed it. What you write and how you go about. There is no right or wrong, or if there are no positive changes that you can possibly think of regarding your loss, that's okay too. So, and the final thing is your vulnerable population assignment. So it's your interview that you're going to do. If you click on there, you'll see the instructions, which are also listed on your syllabus as well in the assignment tab. And you're going to interview 4 people. One of them is you're going to interview yourself. So you're going to ask yourself the questions. You're going to ask a nurse and an administrator and a patient or a family member, especially if that patient is part of your vulnerable population. That would be probably very beneficial for you to get the perspective of those in your vulnerable population group that you're developing your expertise. And you're just asking them 2 questions. How would you define mercy? And where does mercy fit in healthcare? And then you're going to submit it. So you can ask another question of your choice just to make it a little bit more exciting, or maybe a better use of the time that you are taking, as far as, especially for if you're talking to an administrator, sometimes they want to be asked a few more questions. And there's a document here. It's a Word document. And when that opens, you can tell exactly, here are the 2 questions. You might add another one and what your responses are. You can add it right to this page and save it. and then you might just submit that Word document. So that's it for the week. And again, I hope looking through the lens of mercy will add to your to caring for those that we lead and our vulnerable populations. Thank you.